Okay, good afternoon, everyone. I'm joined today by the Lieutenant Governor, Senate President Spilka, by Representative and Chair John Law, Representative Decker, Representative Schwartz. We also have with us Secretary of Health and Human Services Kiami Mahania, Secretary of A&F Matt Gorkowitz, and our Executive Director of the Massachusetts Health Connector, Audrey Morse-Gasteyer. We're here today because there's been a lot of discussion about health subsidies and the subsidies for health insurance that, in effect, help people pay for their health insurance here and around the country. That all happened under the Affordable Care Act, and as you know, that's gone away. President Trump and Republicans in Congress did not take action. They did not take action to extend these health care subsidies. As a result, millions of people around the country, including folks in Massachusetts, saw those subsidies go away, and as a result, we're facing and are facing significant increases in their health insurance premiums, their costs as a result. We've heard here in Massachusetts, people seeing double and triple digit increases in their health care costs. We know that in Massachusetts, between this and what happened this summer with the Big Beautiful Bill, over 300,000 people in Massachusetts are affected. Some of them have already received notice that their health care insurance is going to go up by as much as $25,000 this year. People cannot afford this. And I've been really clear. People in Massachusetts, people across the country cannot afford this. They cannot afford actions which result in even higher costs for health care. And so I want to tell you what we are doing here in Massachusetts. I continue to call on President Trump and Republicans in Congress to act. There's a vote today. They could take action today to extend these health care subsidies for people. But we can't wait for Washington to act. So as governor, in the meantime, I want to do everything that we can to make sure that people can continue to have access to health care, have access to their health insurance. Years ago, the legislature set up something called the Commonwealth Care Trust Fund. It's a fund that's there to help people who are in the Connector Care program pay for their health insurance. It's been operating for several years, and as a result has helped many more people around this state have health care coverage. So here's what we're going to do. We're going to use this trust fund money to provide more financial support. Where the federal government has taken those subsidies away, the state, through the trust fund, will provide additional funds to cover those subsidies so that people here in Massachusetts can continue to receive health insurance for the rest of the year. There are approximately 270,000 Massachusetts residents who will be helped, who will be impacted by this move. That includes a number of small business owners, individuals, seniors, families, all of whom get their coverage through the Connector Care program. Massachusetts, we expect to be providing an additional $250 million in help through the trust fund to help these people continue with their care. So if you are one of these 270,000 people, you will continue to see your health care insurance covered, helped by those subsidies. The state will be covering that, not the federal government. Again, we call on the federal government to act and to provide those funds so that people across this country can continue to access coverage. But we're taking steps where we can. Now, it's not going to help everybody because there are still people in the Connector Care program, an estimated 25,000, who aren't going to be able to qualify for this. There are other people around the state whose premiums we know are going to continue to go up, particularly because of what happened through Congress's action this summer and President Trump signing into law that legislation. But in Massachusetts, like as always, we're working to make health care more affordable. We lead as a state in among all states in helping people to have access to health care and health care insurance coverage. And Massachusetts today is doing more than any other state in the country when it comes to this issue. But we do need Donald Trump and Congress to act to stop these health care spikes and to work to lower costs. You know, as a team, all of us, we're focused on how do we make sure people have access to health care and health care that they can afford? And that's why we're taking this action today, to make sure that these credits continue through the form of coverage by the state, and of course call on Washington to do its job and take action. And as I say, there's a vote today, and I hope that the right measures are taken. At this point, I want to bring forward Director Gasteyer of the Healthcare Connector.
Thank you so much, Governor. Good afternoon. Thank you so much, Governor Healey. It is an honor to be here again with the Governor, who continues to exhibit the strong leadership we need to stay at the forefront of healthcare affordability through our marketplace. As everyone knows, because of Congressional inaction, 2026 marketplace coverage began without enhanced ACA premium tax credits that have been used to help make health insurance more affordable for tens of millions of Americans, including hundreds of thousands here in Massachusetts over the last 5 years. The loss of enhanced tax credits is a serious setback to the financing of health coverage for individuals and families across the state. And our response to that setback as the Commonwealth and as the Health Connector is critically important to all of those people who rely on us for their health care and their financial security. For nearly 20 years, Massachusetts has led the way in expanding and maintaining near universal health coverage. And as Governor Healey said, we will continue to do everything we can to remain a national leader in this endeavor. At the heart of this work is the Health Connector's Connector Care program, which taps into not just federal tax credits, but also state funding to help make health care more affordable to more than 270,000 people through lower premiums and copays, the absence of deductibles, and access to no-cost services and prescriptions for chronic diseases. Connector Care means not just having health insurance with premiums you can afford, but meaningful access to care and services without cost barriers. My team and I hear from Connector Care enrollees every single day that this program is how they sleep at night, that it allows them to manage chronic conditions and stay healthy, that it allowed them to get a screening that caught a cancer diagnosis early, that it allowed them the security to start their own business, that it means they can afford rent and groceries, that it has saved them from medical debt, that in many cases it has saved their lives. Since the Health Connector's inception back in 2006, Massachusetts has valued that kind of protection by including significant state investment in subsidized coverage, first in the Commonwealth Care program and later alongside Affordable Care Act subsidies through our flagship Connector Care program. When the federal government enhanced ACA tax credits back in 2021, they modeled the level of affordability it wanted to provide to the nation after what we had done in Massachusetts because it had worked so well. Now that the federal government has pulled that enhanced support away, we are grateful and relieved to, with an increased state expenditure in 2026, continue to provide the most affordable coverage possible through Connector Care, which is by far the most generous, effective, and successful program of its type in the nation, with the results to prove it. It is why we have the most number of residents insured than any other state. The state's fiscal commitment to Connector Care means that the majority of individuals in Massachusetts whose tax credit amounts have been slashed by federal inaction will see either no premium increases or significantly lower premium increases than they'd see were it not for the Connector Care program. And for people not yet enrolled, it's important they know that the doors to Connector Care in 2026 remain open, as our open enrollment period continues through January 23rd. So if you need help, don't hesitate to reach out. Our customer service center is available at 877-MA-ENROLL, and we have trained knowledgeable, helpful navigators all across the state to assist people in 50 locations. You can find the help you need in your community by visiting mahealthconnector.org and clicking on the Help Center tab at the top of the page. We continue to urge Congress to take action and to reinstate the expired tax credits, and quickly, particularly because there are still tens of thousands of people here in Massachusetts outside of the reach of Connector Care who've been depending on these tax credits. If Congress passes an extension, we are ready to turn on a dime and get that support into the hands of those who need it as rapidly as possible. But in the meantime, Governor Healey, legislative leaders, the Health Connector, and the Commonwealth remain dedicated to delivering the most affordable coverage possible to everyone in Massachusetts. Thank you, Governor Healey, for your leadership and commitment to keeping Massachusetts out front as a leader on health care. And with that, it is now my honor to introduce Senate President Karen Spilka.
Thank you. Thank you, Governor Healey, Lieutenant Governor Driscoll, and thank you, Audrey, for all of the speakers that are here today. I am very proud to stand here today and represent the Mass State Senate with Governor Healey, members of her administration, and our colleagues in the House of Representatives. And I do want to acknowledge the Senate co-chair of the Healthcare Finance Committee, Senator Friedman, who has been a champion for the Senate, and with proudness that we are all standing here with one voice. Wouldn't that be great if Washington could do that? We are standing today on the side of Massachusetts residents, and we are standing on the side of health care affordability and access. It is clear that the Trump administration is more concerned with starting illegal wars, enriching his billionaire cronies, and pursuing powers for its own sake than addressing the very real kitchen table issues that we all face, especially the rising costs of health care. Massachusetts, we know, has long been a leader in expanding access to health care for all residents for decades, and everyone standing here believes that the role of government is to help make life more manageable and more affordable for all of our residents. The Trump administration and congressional Republicans may have forgotten that they work for us, but we in Massachusetts have continued to maintain our strong commitment to our residents. While we will never be able to make up for all of the cuts and irresponsible actions from the federal government, we promise to continue to work together and collaborate together to do what we can to protect our residents and defend our Massachusetts values. I'm proud of the partnership that this announcement represents, and I'm proud to say, Massachusetts, we have your back. And now I'd like to introduce an important partner, the House Chair of the Joint Committee on Healthcare Financing, Representative John Lawn.
Thank you, Senate President Spilker. And on behalf of my colleagues on the House and Speaker Mariano, I would like to thank you, Governor Healey and Lieutenant Governor Driscoll, for your partnership and prioritizing this funding that we have here today. I want to be very clear about why today matters. Because of federal inaction, hundreds of thousands of Massachusetts residents were facing dramatic increases in their health insurance premiums. Not because they did anything wrong, but because Washington failed to do their job. This is unacceptable. In Massachusetts, when the federal government is retreating, we do not retreat with it. Under the governor's leadership and with the legislative support, we are stepping up with the strongest response in the nation. This $250 million increase in the Connected Care is not symbolic. It is real relief for real families who depend on affordable coverage to stay healthy and financially stable. As House Chair of the Joint Committee on Healthcare Financing, I'll say this plainly. When coverage becomes unaffordable, people don't stop needing care. Costs will shift, outcomes will worsen, and everyone pays more in the long term. This investment keeps people covered, it keeps premiums in check, and it keeps our healthcare system stable at a moment when federal policy is doing the opposite. Massachusetts has always led by action. We don't just talk about affordability, we protect it. We don't just acknowledge harm, we step in to prevent it. I am proud to support the governor's plan, and I'm proud to be part of a Commonwealth that continues to put patients first, no matter what is happening in Washington. Thank you, and I will turn it back over to Governor Healey.
Thank you, Chair Lawn, and thank you, Senate President Spilka. I just appreciate the legislature's foresight years ago in putting together this trust fund and the work that many have done for many years in Massachusetts to make sure through the example of the Connector Care, but through other examples, that Massachusetts is leading when it comes to making sure our folks get health care and health care coverage. And we know there's more work to do. Make no mistake about it. I know people are really hurting, and the cost of health care around this country has skyrocketed. And I know all of us are committed to doing everything that we can to deliver for our residents in this moment on health care and on other needs. And I'm proud to be able to work alongside the legislature in making this announcement today. We're happy to take any questions on topic.
Governor, why wait until now to announce this measure? Why not do it earlier when people were still shopping for insurance? I know there's still time for plans to start in February, but why announce this now, not earlier?
Okay, Director, you want to handle that? Sorry.
Thank you. So the help that's being described today is baked into what people are seeing in terms of their premium increases and their contributions this open enrollment. And it's part of the reason that we're hanging in there in terms of enrollment and keeping people covered in Massachusetts. Again, there are tens of thousands of folks who are not getting this help from the federal government or the Connector Care program. But for those individuals who remain eligible for Connector Care, they are seeing this open enrollment that their premiums have been held largely steady. So again, either not seeing a premium increase or seeing one that is very moderated as a result of the Connector Care program.
And I think the other thing is, look, we held out hope, okay? I mean, President Trump continues to do things that makes life harder and less affordable for the American people. Yet, I still held out hope that there would be action before the close of 2025. And, here we are. What day is it? The 9th? The 8th? We gave up until the deadline to see if they'd take action. They certainly heard from people around the country. I can tell you, red state, blue state, so-called, governors everywhere are dealing with this. Certainly you've heard the stories about the cries for help from so many people across this country who are facing these healthcare cost increases. So I held out hope that some action might be taken, but in the face of continued inaction by Congress and detrimental action by the President of the United States, Massachusetts is doing what we need to do.
Governor, Congress previously said that the state could not backfill these ACA fundings. This trust fund has existed for a while. What changed?
It's not a change, and Audrey can speak more to this. The fact of the matter is the extent of the cuts are so widespread. There are certain instances where we may have an existing vehicle to help address some of that. And that's what you see today with the existence of this Commonwealth Care Trust Fund. We're able to take some money, and in fact, it's the way that the legislature set it up to make sure that these subsidies were covered. But, make no mistake about it, we cannot handle the scope and the scale of cuts that have come our way by a federal administration that just doesn't seem to get where people are at. The fact that they can't afford rent, groceries, they can't afford cars, they can't afford consumer goods, and they can't afford health care. And, again, we're going to do all that we can, where we can in Massachusetts. But, it's why we need to see people in Congress step up and take action and fight the president on this and get him to focus on the domestic agenda and how to make life more affordable for people.
Can this continue beyond this year? Is this just a one-year plan?
This is a one-year plan right now, right? There's a new schedule that will get negotiated later, but we're going to do the very best we can with what we have right now. And we continue to call in unison for the president and Congress to take action. Again, they have a vote today.
How much money is in this trust fund, and how is it paid for? Is it employer contributions?
You want to answer that?
So the amount of revenue that we expect in the fund this year is probably around $650 million. Don't hold me to the exact number. There are a number of revenue sources that contribute to that. We collect money from the cigarette tax, probably around $65–70 million. There's money from penalties on employers. That's probably in the $40 million range. We also collect money from EMAC, which is an assessment on employers. And then we also have a state contribution. And part of the reason why we have a state contribution is that the program does generate FFP, but that FFP comes to the general fund. So historically, from time to time, there is a general fund contribution to go into the what we call the CCTF, the Commonwealth Care Trust Fund.
Governor, if Congress does find its way to an extension deal, does this money
The money that's been paid out?
Yeah, or the money that you're proposing today, this one-year plan. Should Congress find a way to extend the subsidies, does this money just return back to the trust fund?
Well, what will happen is we'll revert to the way it has been operating, which is that the federal government picks up a share of that subsidy. And I really hope that that does happen. But in the meantime, this is how it's going to work.
What are the populations that are not going to be eligible for this? For example, the immigrant population, the over 400?
Yes, I'm happy to take that. It's a great question, and we are really concerned about those individuals who are right over 400% of the federal poverty level. Those individuals are losing federal tax credits and don't qualify for the Connector Care program. So there's about 27,000 people that had a tax credit through the federal government and this financial assistance last year up through the end of 2025 are losing it now. So those are the folks we're seeing that have the starkest premium increases. And I will note that the individuals in that population who are over 55, over 60 are seeing the toughest premium increases because of higher costs for older individuals.
Governor, is anyone in the State Human Resources Department facing discipline?
Any other questions on topic?
Can you break down specifically, you said some people will see no increases and some people will see small increases. Can you put definitions on that? How many people will see no increase and how do you define small? What's the average increase that those people will see?
Sure, so we can follow up with additional details. It depends on the individual, where they live, how old they are, and their income. But the 270,000 people in Connector Care, some of them will see no premium increase, so that's probably about a quarter of them. The rest will see a much more moderated premium increase. So without Connector Care, they might have seen a $200 premium increase on a monthly basis. Because of Connector Care, they'll see a $25 premium increase.
Is there a range that will be specified?
It really depends, again, so much on geography and age, et cetera, but we can certainly follow up with additional ranges and detail there.
If this money hadn't been used for this purpose, the $250 million, what would this money have gone to?
This money would have been in the trust fund.
So it would have just been sitting. Is there anything people who have already started paying these raised premiums, what do people need to do to take advantage of this? Will they automatically get it if they're enrolled, or is there a new enrollment process they need?
No, they should just use the process that's already available through the Health Connector. So we were communicating with individuals all across the Commonwealth during the fall to let them know there are these federal changes, but what is the role that Connector Care can play? All those supports have been in effect for people. And so they just need to continue to pay their premiums, whatever is due, in order to stay covered. And for people who are not yet covered, they have until January 23rd to sign up. And we want to make sure people know that this additional help that Massachusetts has set up with its foresight over the years and with this investment, and that people will see lower premiums than they would be seeing if they lived in any other of the 49 states.
So if they paid an increased premium in January, their next month payment would automatically include this subsidy and rebate?
This help is in effect for January because of the way we planned for the possibility of congressional inaction on this topic. So people are already seeing this help today.
Gov, is anyone in the State Human Resources Department facing disciplinary action for the erroneous payment to Lamar Cook?
Look, I'm really upset about that. I mean, that was a mistake. It was unacceptable. And every effort is made now to make sure that that doesn't happen again.
Governor, is anybody facing disciplinary action in the State?
What's important is we've taken action to make sure this never happens again.
Is anybody facing disciplinary action? I understand that you filed a lawsuit.
What's important is that we have in place the right guardrails, the right measures to make sure that this doesn't happen again. I can tell you this was a mistake. And, you know, it goes back to absolutely unacceptable conduct by an individual who was employed by the Commonwealth of Massachusetts. You know, what was done there, as I've said before, was a huge betrayal of the public trust. Action was taken. I was glad that he didn't get bailed today. And we'll continue to support and cooperate with the investigators and the prosecution on that.
Governor, at this level, how is a mistake an acceptable excuse for this? You know, paying off and paying a contract buyout to an employee who was fired after getting arrested on such dangerous and disturbing charges.
Yeah, you know, as a former attorney general and somebody who prosecuted bad guys and people who stole money and prosecuted people who engaged in fraud, waste, and abuse, nobody takes it more seriously than me, and that's why it's unacceptable. I'm very upset about it. We've taken action. It'll never happen again. You know, we go forward from here.
So what action have you taken? Why can't you say if anybody's faced disciplinary action? Is that because, I mean...
It was a mistake.
So is that no?
It was a mistake.
It's hard for people to understand it.
Okay, Matt?
Can you speak about your demand to have private airlines stop flying deportation flights out of Massachusetts, and what you sort of hope to accomplish with that?
Yeah, I mean, a little while back, it came to our attention that ICE was using Hanscom Airport to fly people who had been detained by ICE out of the state. And that raised serious concerns for us. I alerted the DHS Secretary, Secretary Noem, and asked that those flights stop immediately. I have followed up subsequently with the private airlines who were hired to conduct those flights. And the concern is this. I mean, as we've seen, ICE time and time again engages in tactics that are dangerous, overly aggressive, are not making our communities safer. We don't need to look further than yesterday's horrific events to see that. And also what we've seen is that they've picked up U.S. citizens. They've not allowed people due process. They've attempted to, and they've taken people away without due process and access to counsel. It's not right. And I do not want ICE to continue to fly and use an airport in Massachusetts to engage in conduct that violates people's due process rights, violates their rights to legal representation. And I also don't want private companies, these airlines, profiting off of ICE's abuses. So, that needs to end. They need to stop those flights. Those companies need to get out of the business of continuing to work with an agency that time and time again shows that it's full of people who are not trained, not competent, cruel and callous, and importantly for me, who cares about, quality of life and the safety of our communities, not making our communities safer.
Governor, you mentioned the incident yesterday in Minneapolis. I think the governor there is talking about bringing out the National Guard to prevent that kind of interaction. Can Massachusetts do anything to prevent that kind of incident from happening here?
With ICE? The way to prevent incidents like that from happening is for ICE to act in a way that's appropriate, that's lawful. Look, there's going to be an investigation about what happened. We don't know all the facts. I will say, video's video, and everybody can see with their own eyes what transpired. But the answer to this, and the answer to the aggression, the answer to violations of the law, the answer to the harm visited upon our residents, our neighborhoods, our communities, our economies across this country is for ICE to stop doing what they are doing in the way that they are doing it. We now know, and we've now seen, it's not making our communities safer. The Trump administration's been taken to court time and time again on this issue, including several rounds over the presence of the National Guard in communities. They have been rebuked at every turn, okay? And so, that's what needs to happen.
You said the administration's spinning it. Are they?
Thanks, guys.